Hello students, the topic for demonstration is duodenum. The duodenum means duodecaductulose, which means the total length of duodenum is equal to breadth of 12 fingers. It is the proximal, dilated and fixed part of small intestine which is devoid of mesentery. It is C-shaped organ with concavity towards the left side, and the concavity of duodenum encloses the head of pancreas. Now this C-shaped duodenum is divided into 4 parts. The first part or upper part, which is 5 cm in length. Second part, which is vertical, is 8 to 10 cm in length. The third part or horizontal part is 10 cm again, and the fourth part is 2 cm in length. Fourth part continues as jejunum from duodenojejunal flexure onward. We'll start with the first part. The first part, it starts from the pylorus of stomach to superior duodenal flexure. It is directed upwards, backwards and towards right side. Relations of the first part. First part, in its proximal region, it is covered by the peritoneum of greater sac, and it is related to quadrate lobe of liver and gallbladder. Posteriorly, the first part is non-peritoneal, and the only small area near to the pylorus is covered by the peritoneum of lesser sac. The non-peritoneal part is related to the portal vein, bile duct and gastroduodenal artery, and they forms the anterior boundary of epiploic foramen, and the posterior boundary of epiploic foramen is formed by inferior vena cava. Inferior vena cava is separated from the posterior surface of first part of duodenum by portal vein, bile duct and gastroduodenal artery. Superiorly, the first part gives attachment to the free margin of lesser omentum in the proximal part. Inferiorly, the first part is related to head and neck of pancreas. Arterial supply, that we'll discuss in lecture class in detail, but the first part is supplied by the arteries from the foregut. These arteries are supraduodenal artery, which is also known as artery of Wilkie, retroduodenal branch of gastroduodenal artery and infraduodenal branch of right gastroepiploic arteries. Now the first part, it has some peculiar features. As it is devoid of peritoneum, it is the most mobile part of duodenum. It behaves more like a stomach than the duodenum, so it is also affected by the peptic ulcers. Interior of first part is devoid of any mucosal folds, and because of the absence of mucosal folds, in radiograph, the first part, it shows a one region there known as duodenal cap. The first part is supplied by the end arteries, which means if there is any pathology related to the arteries supplying the first part, that will lead to the necrosis of the area supplied by the same artery. Now we'll start with the second part or the vertical part of duodenum, which extends from the superior duodenal flexure to inferior duodenal flexure, and it extends from L1 vertebra to L3 vertebrae. The second part, it runs vertically downwards in front of the hilum of right kidney, lodging in the right paravertebral gutter. The anterior relations of second part, in the upper region, it is related to the duodenal impression on right lobe of liver. Sometimes it is also related to fundus and body of gallbladder, which lies on the inferior surface of the liver. In the lower portion, it is related to transverse colon, and in the lowermost area, it may be related to the coils of jejunum. Posteriorly, the second part is related to anterior surface of right kidney, right renal vessels, right psoas major muscle, right edge of inferior vena cava, and part of right suprarenal gland. Laterally, this area is related to the right colic flexure. Medially, the second part of duodenum is related to head of pancreas, and posterior and the posterior anastomosis of superior and inferior pancreatico-duodenal vessels, which runs in a groove between the head of pancreas and the second part of duodenum on an anterior and posterior aspect. Medially and backwards, it is related to the bile duct and main pancreatic duct. In the interior of duodenum, we can see some mucosal folds. These mucosal folds are permanent mucosal folds known as plicae circularis. And in the second part, we can see one major opening there, that is known as major duodenal papilla. This major duodenal papilla is situated 8 to 10 cm distal from pylorus, and this is a single opening through which the bile duct and major pancreatic duct opens into the duodenum. 2 centimeter proximal to the major duodenal papilla, there is a one more opening that is known as minor duodenal papilla. It provides the opening for accessory pancreatic duct. There is a one circular fold which caps the major duodenal papilla. That circular fold is known as plica semicircularis, and a one longitudinal fold which it goes downwards from the major duodenal papilla, that is known as plica longitudinalis. Sometimes a vertical fold can be seen which extends upwards from the plica semicircularis. Now this vertical fold presents the intraduodenal part of bile duct. The third part of duodenum extends from inferior duodenal flexure to in front of the aorta. It lies at L3 vertebral level. This area is covered by the peritoneum except at the line of attachment of root of mesentery, and superior mesenteric artery and vein are related anteriorly to the third part of duodenum. Posteriorly, the third part is non-peritoneal and it is related to right psoas major muscle, right ureter, inferior vena cava, right gonadal vessels, abdominal aorta, and origin of inferior mesenteric artery. Superiorly, the third part is related to uncinate process and lower part of head of the pancreas and inferior pancreaticoduodenal vessels. Inferiorly, the third part is related to coils of jejunum or coils of small intestine. The fourth part of duodenum extends from the front of aorta to duodenojejunal flexure, which lies 2.5 cm towards the left side from the median plane. Anteriorly, the fourth part is covered by the peritoneum and is related to transverse colon and mesocolon. In the upper region, it is related to the posterior-inferior surface of stomach. Posteriorly, the fourth part is related to the left crus of diaphragm, left psoas major muscle, left sympathetic trunk, left renal vessels and gonadal vessels, and inferior mesenteric vein. Towards the right side, here it is related to the uncinate process of pancreas, and towards the left side, here it is related to left kidney and left ureter. Superiorly, it is related to body of pancreas. Blood supply. The duodenum, it dwells from the junction of foregut and the midgut. So it is supplied by the blood vessels which supplies the foregut and which supplies the midgut. Superior pancreaticoduodenal artery, which is the branch of gastroduodenal artery, which branches from the celiac trunk. Celiac trunk is the artery of foregut. Inferior pancreaticoduodenal artery, which is the branch of superior mesenteric artery. The superior mesenteric artery is the artery of midgut. Superior pancreaticoduodenal and inferior pancreaticoduodenal branches, they divides into ventral and the dorsal branches. These ventral and the dorsal branches forms an anastomosis which runs in a groove between the head of pancreas and the duodenum, anteriorly and posteriorly. This anastomosis gives rise to small vasa recta which supplies the duodenum. Venous drainage. The veins of the duodenum, they accompany the arteries and drains into superior mesenteric and the portal vein. Lymphatics from the duodenum drain into the pancreaticoduodenal group of lymph nodes. Now the duodenum is supplied by autonomic nervous system. This sympathetic component of duodenum is derived from celiac and superior mesenteric plexus, which receives the fibers from T6 and T4 spinal segments. The parasympathetic supply is from both the vagi or from both the vagus nerves. Thank you.